Hi, I'm Susan Taylor with Scripps Health in San Diego, California. By the age of 60, more than 1/3 of women in the United States will have had a hysterectomy. Roughly 600,000 women undergo this surgery every year. Joining us to talk about this is Dr. Kim Huey. She is an obstetrician and gynecologist at Scripps Mercy Hospital in San Diego, California. She specializes in minimally invasive robotic surgery. Dr. Huey, thanks so much for being with us.
Hi.
All right, let's talk about what is a hysterectomy and why is this such a common surgery?
So a hysterectomy is when we remove the uterus. It's common because we use it to address various issues in the gynecologic world, such as pelvic pain, fibroids, endometriosis, and cancers.
What is endometriosis?
So endometriosis is when you have endometrium that grows outside of the uterus, and it typically causes pain. And over a lifetime, it can cause inflammation and adhesions and chronic pain.
And then what about uterine or cervical cancer?
So that's also very common. Of course, we screen it with pap smears and such. And so when it's diagnosed, then we will remove the uterus and the cervix in order to address these cancers.
So, so what are the signs, the symptoms that signal, yeah, I probably need this surgery?
So a lot of times we try to treat these ailments with conservative measurements first. So things like hormones to control the bleeding and pain medications to control the pain. And a lot of times that works, but when it doesn't work, then the patients will start to seek something a little bit more permanent. And that's when the hysterectomy comes in.
And what's the average age of women who get a hysterectomy?
So I would say typically in their 40s, when they're done with childbearing, they're no longer looking for fertility, and they are just tired of dealing with whatever ailment that is causing them. And so that is the typical age for things like endometriosis and fibroids. Now, of course, with cancers, it's a little bit older because cancers tend to strike at an older age.
And so once you have a hysterectomy, you cannot get pregnant after that, correct?
That is very correct. Yes.
Okay. Now, in the past, this has been a pretty big surgery, right? There's been a large incision in the abdomen, several days in the hospital, weeks, maybe even months of recovery. But all that has changed with this minimally invasive robotic surgery, which you specialize in. Talk a little bit about that.
So typically, an open hysterectomy is when we make an incision and we remove the uterus through this big incision. And so it typically involves a hospital stay that is typically 1 to 2 days long. People tend to have a lot of pain. It is associated with more bleeding and infection. With the robot and laparoscopy, we don't make any incisions. And so we have these tiny holes that we insert instruments through, and we remove the uterus that way. And so patients tend to go home the same day. They have less bleeding, less pain, and it just gives them a better experience.
And this tiny incision, it's where? Where's it done?
So one is in the belly button, and two that are about 4 finger breadths to the right and to the left, and that's it. Sometimes you may need a fourth incision just to help with manipulation, but that is it.
And then the recovery time is what? Until you can get back to doing your normal activities?
Typically, we say 2 weeks. Sometimes patients are back to work in 1 week, sometimes a little bit longer, maybe 3 weeks total.
And what about getting back to exercising?
2 to 3 weeks.
And with that tiny incision in your belly button, you can still get back into your favorite bikini, can't you?
Yes, you can.
Sounds good. Any final thoughts, doctor?
So if you have any issues that you've been dealing with, such as pelvic pain or bleeding, talk to your gynecologist about a robotic assisted hysterectomy.
Doctor, thanks so much. We really appreciate you taking the time to be with us.
Thank you.
If you want more information on robotic hysterectomy, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks for joining us.